On behalf of Chair Divecha Center for Climate Change, I heartily welcome today's seminar speaker, Dr. T. Prasanna Kumar. He's a professor as well as a doctor. So, about whom Dr. Parameswar will introduce more in detail. So, today is Dr. Prasanna Kumar will be giving a wonderful talk on importance of sleep. Many of us lose sleep because of work pressure and particularly in corporate sectors, IT sectors and all. So how important it's for us to give good importance for sleep, which regenerates our body. So I need not tell I can much about this. So with these few words, I once again heartily welcome Dr. Prasanna Kumar. And with these few words, I request our founder chair, Professor J. Srinivasan sir, to say a few words in 2 lines about Divecha Center, and then followed by Dr. Parameswar's introduction of today's speaker. Thank you again.
Good afternoon. As all of you are aware, outreach programs are very important as a part of Divecha's objectives. And Dr. Paramesh has organized for last 4 years a monthly seminar connecting health and the environment. We had many lectures in diverse topics. And today there's an interesting topic related to sleep. And I think it's very relevant because, as all of you know, with the advent of the social media, many people don't get enough sleep. They are busy looking at their mobile at home or at their PCs. So this is a good time to know about how important sleep is to our health. And I so request Dr. Paramit to introduce Dr. Prasanna Kumar. Thank you.
Thank you very much, Professor J. Srinivasan. And today's topic is sleep, is very much interested. As you are aware, sleep is an important biological function supporting and regulating many body key functions like healing process from disease, either any disease or infection or environment-related pollution. Healing occurs only at night time. From 9 p.m. to early morning 7:30 a.m. Melatonin will secrete at night time. In addition to that, it also acts as a brain to focus on memory and emotion. Good sleep always helps you keeping your memories. Children study whole night. In the morning, they forget what to write in the examination. It's very much needed. And also, immune system also is beneficial. It affects the immune system, protecting our health, preventing the infection, and balances the endocrine system like appetite, growth, and blood sugar control. Protect the heart and controls the blood pressure. It helps in repairing the muscles and the tissue injuries. When your children used to say that, my grandmother, ಆಟ ಆಡಬೇಕು, ಓದುವಾಗ ಓದಬೇಕು, ಊಟ ಮಾಡುವಾಗ ಮಾಡಬೇಕು, ಮಲಗುವಾಗ ಮಲಗೋಬೇಕು. These are all the timings they had. This is the same thing we are going to hear about it. How important is sleep, inculcate in our habit, not with medicine, without medication. And to talk about this subject, we have none other than Professor Prasanna Kumar T. He is the professor head of the department, Ramaiah Medical College of Ramaiah University and Applied Sciences. He is a senior consultant pulmonologist, Ramaiah Memorial Hospital also. He has over 30 years of experience in the field of pulmonology. His expertise in respiratory diseases with special interest in airway diseases, interstitial lung diseases, pleural diseases, tuberculosis, long COVID care, sleep-related breathing disorders, bronchoscopy, and pleural interventional procedure. He is trained in the interpretation of polysomnography. He has various publications in the national and international peer-reviewed journal for his credit. He is highly skilled physician with considerable experience in the diagnosis and treatment of the respiratory diseases, making him a valuable member of the medical community. We feel very proud he could be able to come, making his time free for us. Sir, over to you. Thank you very much for accepting our invitation. Thank you.
Good afternoon, everyone. Thank you for the kind words, sir. First of all, at the outset, I want to thank you for considering me to give a health talk on a topic which is more relevant at these days. Okay, and today the scope of today's talk is importance of sleep for a good health. So I bring greetings from Ramaiah University of Applied Sciences. I belong to Ramaiah Medical College. Before moving on to the scope of today's talk, let us go through certain case scenarios. So in 1959, 32-year-old popular radio jockey Peter Tripp decided to stay awake for 8 days and nights as part of a publicity stunt in the motive of raising money for charity. So what was observed? So at first he was able to cope up without any sleep, but by day 4, he began to experience certain terrifying hallucinations, imagining spiders crawling over in his shoes, mice scampering around him, and by day 8, he could not differentiate between the hallucinations, delusions, and reality. Eventually, he was able to endure over 8 days of not going to sleep and keeping himself awake. And with the 8 days of sleep deprivation, breaking the world record. And upon completing his feat, he slept 22 hours straight. So, what was the aftermath? So, as psychologists who was looking up to Tripp's downward spiral, they realized that his visual hallucinations were following a pattern, and it was occurring roughly over 90 minutes. It is a cycle that mimics the timing of a REM sleep cycle. REM is the rapid eye movements like sleep state. And though he awoke seeming to have recovered from the wake-a-thon, he went through and resumed to his radio jockey job. However, it was later evident that his experience did not come without long-term consequences. He continued to have certain psychotic behavior beyond the event, and he lost his job, went through marital dispute, and was rarely heard over by the public ever again. One more case, Mr. Gardner. He was intended to break this world record by having spent longest time without sleep. So, and in January 1964, he did exactly that, beating the current one by 4 hours. It means he shunned sleep for 11 days and 24 minutes, and he did it without any stimulants except for certain beverages he used to keep himself awake. What was observed as the days wore on, he had to step up his tricks for staying awake. What he would play basketball, go bowling, but nights were the worst because to keep himself awake without doing anything, it was very torturous to him. And the psychiatric researcher, the John Ross, who monitored his behavior and health, said that he underwent certain severe cognitive decline, including problems with concentration, short-term memory, hallucinations. And on day 5, he thought a room in front of him was a forest, and he became paranoid. So the aftermath here is that he appeared, though he did not show any negative effects, but later suffered from insomnia for years, and he is now convinced that his teenage experiment was responsible for the same. With this background, so we understand that sleep is a fundamental biological process essential for physiological and cognitive function. It means the thought process function. According to the American Academy of Sleep Medicine, sleep is defined as an essential, active, reversible neurobehavioral state characterized by perceptual disengagement from and unresponsiveness to the environment. So what are the benefits of sleep? We have to understand there is physical well-being, and this physical well-being you get it by there's a promotion of muscle recovery and energy restoration, emotional well-being. So there is this emotional well-being. There is uh, emotional regulation, sexual well-being. It helps in the hormone regulation and also increasing the sex drive, the libido. And social well-being, you have an emotional, you build up, you improve the emotional intelligence and also the empathy. And with spiritual well-being, it encourages on self-reflection and mindfulness and a deeper connections to self. So this is what is the benefits of sleep that we have with whatever background we just went through. Like we know that we sleep for at least 8 hours in a day, considering that 8 hours is the biological clock. And if we consider that 8 hours from 10 p.m. to 6 a.m., this is a graphical representation of the sleep stages that we go through over the 8 hours. And there is two states of sleep. One is non-rapid eye movement sleep and the rapid eye movement sleep. And the bar diagram is depicting by the color N1, N2, N3, and the REM. And REM is the rapid eye movement. So N1 is the lightest sleep, N2 is the little lighter than lighter sleep, N3 is the deepest of the non-REM sleep, and REM is the deepest sleep actually. Where REM is, though it is affected, that as the name depicts, as rapid eye movement, but there is complete relaxation of the body. It's like a paralysis of the muscles. So there is completely atonia, we say, or the muscles is completely paralyzed and you're in a deep state of relaxation. If you see the cycle from 10 p.m. to 6 a.m., the width of the bar diagram is showing at every point of time. The N2 stage is present immediately after the patient is transitioned to the sleep. Okay. But you see the N1 is there only at only one point of time. It means the contribution of N1 is very less compared to the total sleep time in terms of percentage. Okay. We'll just look up to what is N2 is mostly important for. As we see, the darker shade is the REM sleep, which is most important for all of us. Most of the times in the sleep related breathing disorders, patients will not be reaching REM at all. Patient is not reaching N3 also. They are spending most of the sleep time in N2 only. It means there's a lot of distortion in the sleep architecture. So much of micro arousals that is happening for many reasons that we'll talk in future. But this REM sleep is the most important part of the sleep stages. You see that the width of the bar diagram of REM sleep also becomes wider beyond 2 a.m. And you see that is the time we have a most relaxed sleep, that 2 a.m. to 6 a.m. And again, this is related to the circadian rhythm, and we'll go to see how is the circadian rhythm is helping. What do you mean by circadian rhythm? So like Sir was actually telling about, you sleep in the night 10 a.m. as the melatonin secretion starts. Well, it was in 1729 where the astronomer Jacques, he showed that this mimosa plant leaves, okay, which normally open during the day, did not even if kept away from light. It means it continued its rhythm for several days and it indicated an internal biological clock. What it says, there is circadian rhythm in every living being, whether it is a unicellular organism, whether it is a multicellular organism, whether it is a mammal, whether it is insects, scorpions, crustaceans, every living being has a restful state, which is similar to sleep. There are certain organisms, living beings, though they don't close eyes, but they do have a restful state, which is very much similar to sleep. And for humans, we see that there is something, the suprachiasmatic nucleus. It's a small center in the brain which governs this sleep regulation. And this suprachiasmatic nucleus is reflected and it is influenced by the light and also the melatonin. The melatonin again is a hormone which it is secreted more in the night and is solely responsible for us to go to sleep. And you see that the melatonin secretion moreover starts at somewhere after 8:39 p.m. and the secretion stops at around 6:30, 7:30 a.m. So that is when you see the circadian rhythm. And this interaction, this homeostatic drive of circadian rhythm to keep yourself alert, to keep yourself wakefulness, and to go to sleep. There are two models that are involved. One is process S, that is the sleep pressure, and the process C, that is the circadian rhythm pressure. So these two are acting together. Okay, once in the wakefulness where the alertness level is very high, this builds up progressively the sleep pressure, which will actually influence the circadian rhythm and the sleep per se in the night. So this is the homeostatic drive that is involved in the circadian rhythm, and that there is a two process model of process C and process S. This diagram is depicting the similar thing where you see the alertness and activity is more in the daytime, where the cortisol levels are high. Okay, and the melatonin levels, which are responsible for sleep, are more high in the evening hours after 9 p.m., 8:39 p.m. So this is how the regulation of sleep is taken care. We all know that this circadian rhythm changes by age. So the children who are less than 2 years, they sleep for longer hours. Everyone would have noticed this. They are sleeping for most of the time in a day when they are born. By 2 years, it becomes 13 hours. By 5 years, 11.5. And by adolescent and adult, it becomes 8 hours. And this nap sleep latencies means the napping is sleeping. This latency is the time of you being on bed and time to fall asleep. This latency is again influenced and increases with age. That's what we are trying to show it here. And it is definitely attributable to the slower accumulation of sleep pressure, which I was talking in the previous slide. So this is the normal sleep we usually record in a regular polysomnography. So polysomnography is a sleep recording. We record more than 7 parameters here. And we have shown that there is wake, there is non-REM 1, 2, 3, and also there is REM staging. And you see, as the patient is awake, you can see the, I can show it here. You can see that the wake side where immediately in the transition of the sleep, there's a dip in the graph, and that patient goes into the non-REM 1. Okay, non-REM 1, 2, 3, and not the 4, it goes to the REM staging. So this is the normal level, and there should be a proportional distribution of these sleep stages and at a normal level. So the purpose of analysis, the overnight sleep has been divided into 3 equal periods. First third, which comprises the highest percentage of non-REM, and in the middle third of the night, and the sleep in the last third of the night, where the majority is the REM sleep, which I've already shown in the bar diagram earlier. So this is the distribution. So most of the time we are spending in N2, non-REM, nearly 45 to 55% of the total sleep time we are spending on bed. Okay, and you see the REM 1 is only hardly 5 to 10%, and REM is more important for us for restoration of health. So this is again our sleep analysis, which showing the disintegration of the sleep stages. And with this, we know that sleep plays a very significant role in almost every system of the body, and insufficient sleep increases risk in all the systems. And the consequences are there in the mental health, cardiometabolic health, immunodeficiency, the patient is prone for infections, hormone imbalances, obesity, and also the pain regulation. So in N1 sleep, why is it important? Transition to N1, there is nothing that is happening there, and you're spending hardly 55% of the total sleep time. And N2, that's a light sleep, you have a declarative memory consolidation, and N3, there is more of energy restoration. And that is why the N3 is important. You have a detoxification, you have an energy restoration, like Sir was telling about, healing process that is happening, and it is more in the stage N3, the non-rapid eye movement sleep. And this emotional regulation and procedural memory consolidation is mostly seen in the REM stage of the sleep. So sleep and metabolism. So there is, it's already mentioned that there's these metabolic disturbances. And metabolic disturbances, first and foremost, it comes to the glucose metabolism. So there is increased insulin resistance, and there is increased pro-inflammatory cytokines, and sleep deprivation is also a kind of pro-inflammatory state. And with this increased insulin resistance, there is increased glucose levels, and there is increased free fatty acid as well. And there is also another way of decreased adiponectin, which is also responsible, and insulin like growth factor 1 and leptin levels, which are also involved in this glucose metabolism. And what does it lead to? It leads to diabetes. So anyone we see patients with sleep disordered breathing or sleep disorders, we go back to ask the patients whether they have diabetes, whether they have hypertension, whether they have dyslipidemia, altered cholesterol level, they have hypertension, they have any coronary artery disease, they have kidney disease. It's all again related to this kind of metabolic disorders that's happening due to sleep and sleep deprivation. And with above factors that is going on in the background, there is central insulin resistance, the blood-brain barrier dysfunction is also noted, and there is neuroinflammation. So now there is a newer concept of G lymphatics that we'll talk in the last slide, where this G lymphatic system are responsible to remove all the toxic proteins and all the end products of metabolism that is produced from the brain through a conduit of cerebrospinal fluid that is formed in the brain, and it is removed through the venous channels. Like that happens in our other parts of the body in the lymphatic channels. And this amyloid B protein accumulation and cognitive impairment are responsible with aging for neurodegeneration, causing Alzheimer's disease, Parkinson's disease, stroke, and many neurodegenerative processes that can happen in the late in the age. So we discussed this, that the sleep deprivation, they have an indifferent directly affecting the immune system. The natural killer cells production is decreased and the functioning is decreased, and therefore they are prone for viral infections and also the cancer cells as well. The inflammatory cytokines, I said it is already a pro-inflammatory state. Thus, there is a surge in inflammatory cytokines, and because of the inflammatory cytokines, all the cardiovascular morbidity that is noted and has been spoken is related to pro-inflammasome paradigm, where there is inflammation caused by inflammatory surge of cytokines causing some kind of vascular injury, endothelial injury, atherosclerotic plaque formation, and so on and so forth. And infections with deprived decline in immune system. So there are any sleep deprived patient are prone for infections. Like I mentioned, sleep health, either because of poor sleep quality, insufficient sleep duration, or excessive sleep duration, okay, or because of the obstructive sleep apnea. It's another entity that is an importance for the pulmonologist perspective. We'll discuss. And these three together can have a lot of impact on systemic inflammation, where it is causing coronary events, hypertension, arrhythmias, metabolic syndromes. Okay, all this are related to this sleep health. Either it is because of sleep deprivation or it is because of the obstructive sleep apnea, which is in turn more impactful on the cardiometabolic risk and cardiovascular health. So coming to my domain, the respiratory health. Okay, so we talk about two things when it comes to sleep. So when there is a poor sleep quality, the patient is having a easy fatigue, decreased alertness, and impaired focusing and concentration. He presents more of on like a fatigue, easy fatigue. Okay, this is more so is perceived as shortness of breath, tiredness, or breathlessness. Okay, now there are two entities when there is a patient who's presenting with obese patient who's presenting with OSA, that is obstructive sleep apnea. It could be because of OSA related breathlessness, or it is because of the obesity related breathlessness. And when the patient is not fitting in both of these things, so that is when we see what are the other causes of patients having this symptoms of sleep deprivation. There are reasons like because of deprived sleep, there is decreased cortical inputs. We have already shown in the previous graphs that the cortical inputs are important for you to keep up alert and awake. The respiratory center sensitivity is decreased. The chemosensitor or mechanoreceptor sensitivity for related to lung health, breathing in, breathing out. Okay, and the respiratory muscle contractility along with the respiratory pump and the lung mechanics because of the airflow resistance with underlying lung conditions. So these are all can cause hypoventilation. There is decreased ventilation to the lung, and therefore there is decreased oxygenation. And with decreased oxygenation, there is more of carbon dioxide buildup that can go for increased carbon dioxide retention, hypercapnia. With mental health, so anyone I was just mentioning in the first two cases, stress and worry, so difficulty focusing, feeling of fatigue, declining mental health, insomnia, and poor sleep. So these were the two things. These are things were already mentioned in the first two case scenarios which I had mentioned in the beginning of this class. So for the longevity, you need a restorative. You need a quality sleep for longevity, which has restorative benefits, mental health, hormonal balance, cellular repair, cognitive function, immune support, and also for the longevity. So we know that there is a consequence of sleep deprivation. You have, because of the reduced reaction time, you are having a higher risk injury. You would have seen many vehicular accidents. Okay, we go back and see why did the patient have a vehicular accident. And most of the OSA patients, obstructive sleep apnea patients, who tend to fall asleep, who have an excessive daytime sleepiness, we go back to see what or the reason, because would be the reduced reaction time when they're driving, and therefore they are prone for higher risk of injury and vehicular accidents. And with sleep deprivation, the stress and anxiety, you become irritable, you're jittery, you're not focusing, the poor concentration, low energy levels, and there is decreased mental performance in your day-to-day life. So there are certain stages also being described with deprivation of sleep: 24 hours, 48 hours, 72 hours, and beyond. What is happening? It's again the same thing. There is cognitive impairment that begins. There is memory fades, emotional stability is lost. You have an increased stress hormones, and beyond 36 hours, again you start having small naps. Micro sleeps are there. Cognitive abilities have declared coming down. You become more irritable, anxious, and beyond 48 hours, you start hallucinating, like how the case scenarios I mentioned. So there was hallucination, delusion, muscle weakness, fatigue, and the affecting the physical and mental health. And beyond 72 hours, so there is a disorganized thoughts, speech becomes incoherent, psychotic behavior sets in, and there's a physical deterioration also that worsens. So sleep deprivation has impact on all these functions, whether it is cognition, the thought process, immunity, for immunological process, for defensive mechanism, metabolism. I've already mentioned about the diabetes, hypertension, dyslipidemia, cholesterol levels, stroke, uh, everything related to the metabolism, psychology. We have just seen the level of mental health after the sleep deprivation, and cardiovascular due to micro arousals during sleep. Okay, there would be increase in the sympathetic activity, which will cause damage to the endothelium of the blood vessels in the heart, which can attract the atherosclerosis. Therefore, you can develop coronary artery diseases as well. There are certain external factors that can also influence the sleep, like the breathing. We see why the breathing is affecting. It could be because of normal or abnormal breathing, stress, substance abuse, physical activity, sleep schedule, social connections, weather, diet, and so forth. So for a good sleep quality, you better have a consistency going to bed, waking up at the same time every day, including the weekends, so that you reinforce the sleep-wake cycle. The quality over quantity, where even if you are sleeping for a very less time, the quality is what is better than 9 hours of interrupted poor quality sleep. So the body signals, you listen to your body signals. If you are not feeling good in daytime, it means you didn't have a good sufficient sleep. And if your body feels alert, refreshed during the day, you are likely getting a sufficient sleep in the night. So for all those who are going through this sleep wake disorders, you try to keep a sleep diary, record all these things like going to bed, waking up during the night, and why are you waking up in the morning, taking naps, exercises, substance abuse like drinking alcohol or caffeinated drinks, and also certain medications also should be avoided before going to sleep. Recently, March 13th, we observed March 13th as the World Sleep Day. So this World Sleep Society, they came up with sleep hygiene tips. So how do we look at it? So 10 tips for a better sleep. The theme this year was sleep well, live better. How do we do that? So establish a regular bedtime and waking time. So you allow yourself to take a nap if you are tired. Okay, adjust a healthier lifestyle regarding your substance use. Create a caffeine cutoff time. Please don't use caffeine at least 3 to 4 hours before you are sleeping. Change up your bedtime snack. If at all, it's always better to avoid meal just 2 to 3 hours before sleep. Watch your workout routine. Don't do strenuous physical exercises just before going to sleep. Use comfortable, inviting bedding. Find a comfortable sleep temperature. The environment, the sleep temperature, and setting up the room well ventilated is also very important for you to get a sound sleep. Block all that is distracting you, whether it is light, it is the screen time. Okay. And reserve your bed for sleep, avoiding its use for work and other general activities. So there is also certain data that is showing that they have compared that insufficient sleep with alcohol intoxication. So they show that research showing that effect on performance of even a moderate level of fatigue, which is equivalent to or greater than what is considered as the acceptable alcohol intoxication. You see the graph, it is almost the same. The dosage of alcohol and hours of wakefulness, the sleep deprivation and alcohol intoxication, the amount of fatigue that is being compared, it is almost same or maybe more than that. So moving to the end of the thing about the pulmonologist perspective, why are we related? Why are we worried about the sleep? So it is because these three entities we see day in, day out. OSA, the obstructive sleep apnea, COPD and sleep, it's called as overlap. What is COPD? It's chronic obstructive pulmonary disease. It's affecting the airway of the lung, and it is due to a chronic exposure to intoxicants, cigarette smoke, pollution, environmental tobacco smoke pollution, the many risk factors for the patients to develop COPD. Mostly it is because the environmental tobacco smoke being the prime cause for the COPD. And with the COPD and sleep, if they coexist, it is another deadly combination, and something called as obesity hyperventilation syndrome. OSA, it is nothing but a sleep disorder where because of the increased adiposity around the neck, the upper airway of the lungs, they are more prone for collapsibility. And because of collapsibility, there is episodes of complete or partial obstruction to the airflow inside the lung, and for which there is arousals. So these micro arousals, which is not known to the patient, will be distorting the sleep architecture, and there is no continuity of the sleep. So what will happen if there is a symptoms of sleep apnea? You are having a poor concentration, you are low mood, you are restless, you have a heartburn. Okay, you wake up in the middle of the night with heartburn, or you wake up in the early morning with the dry mouth and dry throat, early morning headaches, night sweats. I have heard people talking about just stripping off that clothes because they're sweating in the night. That is because they're choking in the middle of the night. And there is insomnia otherwise, which should be recorded again. And weight gain, excessive daytime fatigue. What we talk about, we ask for the patient is the excessive daytime sleepiness. Whether the patient is sitting doing nothing inactive in the daytime, is falling asleep without involuntarily, is also a reason, could be because of the sleep disruption. And other things like irritability, forgetfulness, and frequent urination in the night can also be one of the features that we seen in the sleep apnea. So risk factors are obesity. All those obese with BMI more than 30 should be screened for sleep apnea. And the positive family history, certain factors like genetic factors where Down syndrome or the Pierre-Robin or Marfan syndrome, where there would be some anatomical disfigurement, of the upper airway, of the face, of the jaw, to say that nasal adenoid or tonsil enlargement, acromegaly and hypothyroidism. Patient is a little, the body habitus is different. They look obese. The stature is different, and the structural upper airway disorders like large neck, the temporomandibular joint abnormalities are there. There is the jawline is pulled back or pulled front. Okay, whether it is retrognathia or micrognathia, there is a large tongue that's called as macroglossia. There is some palatal abnormalities. These are other disfigurement in the face and the upper airway that can also cause sleep apnea. May not be that the patient would be obese and the BMI would be high. So out of 100 patients, 80% of the sleep apnea patients are obese. When I say obese, it is BMI more than 30. Okay. The rest 20% are lean sleep apnea. Why there is a lean sleep apnea? It means even though they are lean, they can still have a sleep apnea, and they can have all the consequences of sleep apnea. That could be majorly because of the factors here observed, like genetic factors. There is nasopharyngeal abnormalities. There is other medical conditions. There is structural upper airway disorders. These are the reasons that where the lean OSS can also present with. There are updated guidelines where if you have a sleep apnea, we have scales, we have scoring systems to measure, to stratify whether the patient really have a sleep apnea and should undergo a sleep apnea test, that is the polysomnography. Again, polysomnography has a level 1, level 2, level 3, and level 4. And level 1 is most recommended one, as we, so that in level 1 we see all the stages of sleep that we have recorded, and we can see how the shift of stages happens and when is the sleep apnea and sleep distortion happening. Treatment, here for treatment of OSA, it's more of a, when you say there is upper airway collapsibility, you have to splint the airway. So to splinting the airway, you need a PAP therapy. PAP therapy is nothing but the positive airway pressure treatment. The CPAP, the continuous positive airway therapy. And the PAP therapy is the gold standard and standalone treatment for the OSA. And there will be other conditions where you don't need, where the patient don't tolerate the PAP therapy, and there are many more available management tools we have for beyond CPAP to treat such patients. And COPD and OSA, I was just telling about this combination being more deadly. The reason being, the COPD patient already with a damaged lung, they are having difficulty to breathe when they're awake. And just imagine if they are also having a sleep apnea, they're having hard to breathe even when they're asleep. So this is the reason that, this ventilatory function, the important function of the lung is ventilation. And this ventilatory function is at stake 24/7, where they're having hard to breathe when they're awake and they're hard to breathe when they're fast asleep. So this COPD, OSA and overlap syndrome is more dangerous and needs urgent attention for treating. So how do you treat that? So the OSA is more of upper airway collapsibility. So the upper airway, the throat, where you want to splint the airway by giving a continuous positive airway pressure, that is the CPAP. And NIPPV, it's the non-invasive positive pressure ventilation. And there are alternative therapies like weight loss. Now we have drugs available for weight management. So these drugs are injections which are very expensive, which are just available in the dashboard, where this weight loss can have a great impact on weight management, especially for these obese patients who are BMI is beyond 35 and 40, and even a 10 to 20% of weight loss. Say a patient is 140 kilograms, okay, and 20% weight loss has a major impact on this morbidity, and there is also sometimes a near normal symptom relief and also disease modification. So this is the reason. And another last terminology is the OHS, the obesity hypoventilation syndrome. Many of us will not be knowing that they're having OHS. So they would be visiting hospital for the reasons of breathlessness, the short of breath. So there is a repeated medical attention. So there more or less there will be the BMI is more than 35. Okay, they'll have a repeated hospital medical attention for breathlessness. They have hemoglobin levels being high. They have pulmonary hypertension and many other conditions. And that is when you have to look for obesity hyperventilation. And for obesity hyperventilation, if the BMI is more than 35, if there is a surgical correction like bariatric surgery, it can be a core therapy for improving such patients. other than giving a non-invasive positive pressure ventilation. So here the OHS management is you change the lifestyle, you exercise, you want to lose weight, you have a dietetic measures. Okay, you'd go for a rehabilitation program to cope up with your inabilities, and the PAP treatment, the positive airway pressure treatment, remains a cornerstone. And yeah, if there is a bariatric surgery that can help you lose weight, and losing at least 20% of the body weight has a great impact on such patients having OHS. Modern advances, now everybody is wearing a smartwatch, and we have all the smartphones, and this artificial intelligence and machine learning, these scoring variables also, they are with not with precision, with accuracy, they have been accepted. And there are peripheral arterial tonometers, that PAT sensors, which also acts like a ring system, where if you just hold it, it's a Bluetooth connected with an app based. It tracks the autonomic nervous system activity, and with every time there is a sleep disruption, there is a autonomic overactivity. I've shown in the previous slides. There is sympathetic overactivity, and every time there is sympathetic overactivity, this is recorded in this peripheral arterial tonometry. And this vasoconstriction, or the blood visual constriction, that is recorded in the fingertip with the peripheral arterial tonometer, can also record your sleep images and map it. So there are other things that are available, that is job motion tracking and respiratory effort patches. So though they are available, they are not FDA approved. And behind apnea, there are other advanced sensors and home audio video recording, which allow for diagnosing the complex parasomnias and not just respiratory issues. What are the research frontiers in sleep now? The G lymphatic system, which was never heard. Even I have never read about it before when I was doing my graduation. So G lymphatic system stands for glial lymphatic system. So lymphatic system is nothing but it is there in our body elsewhere, everywhere, and it is responsible to remove all the toxins, metabolites, or end products of metabolites to the area where it can be completely metabolized and removed. Okay, and that is there everywhere. But it was always questioned that whether the brain also has something like this lymphatic system which is there in the body, and which is now come up to light that the G lymphatic system is responsible for removing this toxic metabolites, especially the toxic proteins that are produced in the brain, and especially that suprachiasmatic nucleus, which is responsible for the sleep regulation. If there is accumulation of just such toxic proteins, so they are predictor of disease, not just a consequence. And this becomes one of the biomarker for us to look for prediction of future neurodegenerative disorders like Alzheimer's, Parkinson's, stroke, and other things. Digital biomarkers are also in a forefront along with the artificial intelligence in sleep medicine. We now have a complete recruited overnight sleep technician who is trained in monitoring the sleep rhythms, recording the sleep cycles, and he is there awake all through the night. Okay, if there is suddenly there is some disengagement with the patient, with the models or with the leads, so he is there to monitor so that there is sleep recording happening. But in future we have AI that will take over the sleep technician job and help in interpreting these polysomnographic reports. Sleep is essential and it is not optional. So good sleep, there is a better life quality. Thank you. Be happy to take questions.
Yeah, in military, people go a lot of sleep deprivation, those who are in the border.
Yes, sir.
So has Indian military done any work on that? Military has lot more difficulty than normal people, right?
Correct, sir. Yeah.
So has any research gone on
No, I don't.
deprivation among the people
In the border. Yeah, I
any
mean,
work?
this is a good thought. I really don't have any insight on these things. I should look upon it. Yeah, but there is definitely the sleep deprivation has a lot of impacts on ill health, and they should be screened and looked for. We have done projects and research in road transport drivers who are prone for vehicular accidents, and we have screened as much as people were having sleep apnea and they didn't know about it. And that would also affect the daily routine of their, and especially the drivers who are the long hours driving. Yeah. So they are prone for many other consequences of long haul driving, whether it is the flight or whether it is driving any vehicle. They should be screened for, and we all know that the pilots they have to go through something called as the multiple sleep latency test before they are cleared for giving the pilot license. As I am not aware about the soldiers and the border security, I will just go look into it. So thank you. Yes.
One there is a problem with nasal congestion or whatever. The treatment is looking at the lungs. So I was just wondering why is there treatment for something with the nasal problem directed towards the lungs?
Okay, there is something called as unified airway hypothesis, where the airway, the breathing starts from the anterior nares, this part, and ends up somewhere inside the lungs. That is the alveoli. So alveoli is the area where this gas exchange is happening. What is the function of lung? Gas exchange. You breathe in oxygen, breathe out of carbon dioxide. That is the first prime function of the lungs respiratory system. And the airway starts from here, and therefore the airway hypothesis, what it says, any insult in the upper airway can eventually land up with the lower airway. So any inflammasome paradigm that sets in the upper airway can end up in the lower airway, especially the airway disorders. So that is the reason every doctor, when there is a nasal congestion or nasal allergy, rhinitis, rhinorrhea, or whatever the upper airway symptoms they are, they want to make sure and see if there is already a affection of the lung as well.
Who sleeps only 4 hours per day with good physical habits like doing yoga and all, and then claims that he is very normal with no medication and with good memory and other things. What is your view on that?
So yogic practices, they have shown questions on health, where even the food habits or the sleeping habits, the basic necessities, where this by doing yoga, even 4 hours of sleep is a quality sleep. So therefore, I have mentioned that the sleep cycle stages. So if you are attaining the total sleep time, if you are attaining that the sleep stages like N3 and REM, I think you will have a sufficient sleep for your normal routine the next day. And that is the reason even we want to record sleep related behavioral patterns minimum of 4 hours. It is not mandatory that we record every patient to be sleeping at least for 8 hours for us to come up with an interpretation that you have a sleep related breathing disorder or whatever. Okay, that is not happening. That is the minimum set time here is 4 hours, for the reason that the patient has to go through these sleep stages, and attaining that N3 and REM sleep is utmost important. And I have already shown that at least if the REM sleep is 15 to 20% beyond, and the REM latency is achieved in a short period of time as normal, then there is restorative sleep.
Disturbed sleep, even if they have a good physical activity for their age.
No, I was telling about the circadian rhythm, that is the nap latency is progressing over age. Okay, and this physical activity or mental activity, whatever the well-being, where the sleep pressure, I've spoken about the two model process that is involved in regulation of the sleep. Okay, only when you would have come through situations where you would have slept late, you've been up late for whatever reason, and you still not feeling asleep. You would have also slept in the daytime and feeling difficulty in sleeping late in the night. You would have done a physical activity with strenuous physical and mental activity, and you would sleep more than what is required in the night. And you would have also come through situations where they would travel to a different time zone. Okay. And you feel tired and start having naps every now and then. So these are the 4 different scenarios we talk about when we are talking about the circadian rhythm. And yes, there is this sleep pressure, the process S and process C, they are acting together. There is an additive acting, there's additive effects where they have to cope up for the complete regulation of the sleep, even for the elderly. And there would be circadian rhythm changes as you age. That's what I mentioned. With age, all the circadian rhythm changes. And with age, there is so much of neurodegenerative changes also is eventually happening. Thank you, sir. If there is no question.
Great.
Sanka, you covered so well. Wonderful. How sleep is very much important. So for your health and all things. Now I have some question to ask before I conclude. I think we found out that children sleep, disturbed sleep phenomena, sleep disorder breathing. In general pediatric population, we found out 8% of the children sleep disorder breathing. In them, 1.05% obstructive sleep apnea syndrome. And people who get a chronic cough of allergic rhinitis, whatever it is, upper united airway concept we highlighted, we have that concept. Children coughing more than 2 weeks, the same intensity. In them, 17% of them have sleep disorder breathing. And in the adult population, what percentage do you see in this kind of situation?
Moving per se with like children, usually, sir, you said only 8%.
Yes.
And why? Because 8%, most of them are related to the upper airway. And
Yes.
it would be because of the adenoids and the tonsils. And the upper airway, it's not about the adults, what we talk about adult sleep medicine, where we talk about the upper airway collapsibility or the nasopharyngeal anatomy that is affecting the airflow, causing this apnea or hypopnea, airflow being completely stopped or hypopnea being reduced to less than 50%. For pediatrics age group, it is more of the upper airway disorders. Basically, the tonsils.
No, I wanted the adult level, what percentage you see sleep disorder breathing?
For them, surgical is done. They are fine. That is the reason the sleep apnea is very low for pediatrics.
Okay.
For adults, it's again nearly 20%, 22%.
Okay.
They have this sleep apnea. And if I have to say that, taking that, all that patients who attend the adult sleep clinics, 80% of them are obese.
Okay.
Okay. And this obesity being the most impactful intervention and modifiable risk if we can take care of these patients.
Okay, thank you. That percentage. And also we have a case here, the laryngeal dyskinesia, chronic cough. In children, we found out 3.5%. So they get panic and also they have to relax and breathe properly. Have you seen what percentage is that? What do you recommend for them?
Usually, when there is breathing disorder.
Laryngeal dyskinesia in particular.
Yeah, breathing disorder. One of them being the vocal cord dysfunction.
Yes.
So when we say it is, when it pulmonologist perspective, it is the difficult to treat asthma, where it is, out of all the issues that you're trying to cope up, this vocal cord dysfunction falls into this difficult to treat asthma category. And this is very, very, other than this tracheobronchomalacia and whatever the cartilaginous disorders, the congenital disorders, it is very rare to see a laryngeal dyskinesia compared to the pediatric care.
Okay. So we recommend them, don't get panicky, just breathe like a panting like a duck.
Unless
they have it.
Unless they have a anatomical disorder.
So they don't have any anatomical disorder. These are all the.
It's all about reassurance.
Yes. And also you also mentioned about the CPAP. I have to share with you. CPAP first identified Gregory Pipson Tooley in San Francisco. I think it was in 1972. And we were the second one in USA utilizing CPAP in premature babies. where Robert Gregg, Parmesh, and Bartolotti, and India were the first one used, tried CPAP in Gunishila nursing home earlier there. So I think it has become quite popular, the splinting to helping and all those things. And also you mentioned about the alcohol related and sleep. I think 2023, Harvard University data has come. How much alcohol one has to take? You cannot, because you should not get tipsy, whatever it is. I think they mentioned about beer having nearly 4% alcohol, you can have 600 ml. Wine being around 10% alcohol, you can have 300 ml. Whiskey, rum, gin being the 40% alcohol, you can have 90 ml. Ladies should have 50% less than that one, so that their metabolism is less. And you have to consume slowly. So this is being beneficial for the wine being in a cardiac patient. Cardiologists recommend that to take wine, vasodilatation and happens and all this thing. What is your opinion in that context?
Ideally, anyone who's having a sleep disorder breathing, you should train them to using alcohol. Though there are papers which are saying that the concentration of alcohol is directly proportional to having the sleep apnea, apnea-hypopnea index. Even a small dose of alcohol can also impact the ventilation, that the apnea-hypopnea index, and it is completely advised not recommended for any sleep apnea patients to recommend to use this alcohol.
Slow sleep is so important in the predicting of the disease. So thank you very much. A wonderful talk, interacting with us, and we learned a great deal. We are very happy for you over here. And on behalf of the DHS and the climate change, we like to